everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In this episode, we're going to be discussing a medication known as Eletriptan. Its brand name is Relpax. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find the information to be valuable, please consider leaving a like on the video, as it would really help me with the YouTube algorithm. So Eletriptan has high affinity for 5-HT1 receptor subtypes. These would be serotonin receptors. More specifically, it seems to target these receptors in intracranial blood vessels. It acts as a receptor agonist at these sites. In terms of indications for use, Eletriptan is indicated to be used in the acute treatment of a migraine. Now, before somebody was to use Eletriptan, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. This medication will be contraindicated in patients who have coronary artery vasospasm. It should not be used with potent CYP3A4 inhibitors, such as ketoconazole. If an ergotamine-containing agent was used in the previous 24 hours, Eletriptan should not be used. Eletriptan should not be used to treat hemiplegic or basilar migraines. If a patient has uncontrolled hypertension or high blood pressure, they should not use Eletriptan. It should not be used by patients with ischemic bowel disease or ischemic coronary artery disease. And patients with peripheral vascular disease or a history of a stroke should also avoid this medication. Now, in terms of precautions, it should be noted that arrhythmias, such as ventricular tachycardia, has been reported with the use of this medication. Coronary artery vasospasm may happen while using this medication, even in patients that don't have coronary artery disease. Patients should be made aware that there has been cases reported of patients experiencing a myocardial infarction or a heart attack within hours of using this medication in patients both with and without coronary artery disease. Use of this medication is not recommended in patients who have severe hepatic or liver impairment. Hypersensitivity reactions such as anaphylaxis or angioedema has been reported with the use of Eletriptan. Patients may experience what's called a medication overuse headache if they use this medication more than 10 days in 1 month. Feelings of pain, tightness, or heaviness on the chest has been reported with the use of Eletriptan, and if this was to occur in patients at risk of cardiovascular adverse effects, they may want to be checked out by their physician. Patients should be made aware about the risk of serotonin syndrome that may occur with the use of this medication. They would be at more of a risk of experiencing this if they were using other medications that also affect serotonin levels. Now, once somebody has cleared the contraindications and is made aware of the precautions and warnings, and they start to use Eletriptan, they can expect to receive their dose orally. So if somebody is using this medication in the acute treatment of a migraine, they would typically take 20 or 40 milligrams orally as a single dose. If they experience relief of their migraine symptoms, but then the symptoms seem to come back, they can repeat their dose in 2 hours. The maximum single dose would be 40 milligrams, and the maximum daily dose would be 80 milligrams. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Eletriptan, so I'll go over some of those here now. Up to 8% of patients may experience nausea, and 4 to 10% may experience anasthenia or abnormal weakness, and 3 to 7% may experience somnolence. Now, some more rare but serious side effects would be chest pain, coronary artery spasm, a myocardial infarction, a hypersensitivity reaction, or serotonin syndrome. That's all we're going to talk about today with Eletriptan. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.